think I just heard cancer and I just was terrified. I thought it was a death sentence. I thought, okay, I just saw our lives flash before us.
I'm Darrin Willingham. I'm a physician at Mayo Clinic, abdominal transplant surgeon. I was diagnosed at age 43 with colon cancer.
When I found out my husband was diagnosed with cancer, I was terrified. It was not something I expected. It was the last thing I expected to hear.
A long time ago, I used to have problems with esophageal spasm and esophagitis, things like that. So a good friend of mine at the clinic, the hepatology gastroenterology fellow, was encouraging me to go and just get it checked out, get an upper endoscopy. I said sure, and so I got the appointment to go ahead and get the upper endoscopy, and then I put that off. And then I got the appointment again to get an upper endoscopy, and I put that off. And then so I finally, just so my wife wouldn't be completely mad at me, said, all right, I'll get the upper endoscopy, fine, go ahead, let's get that done. So I meet with the doc about an hour later, and he goes, Darrin, we found a lesion. I said, is it esophageal cancer? He goes, no, it's colon cancer. We found a 5.5 centimeter, mass in your colon, and it's ulcerated, and it looks just like, colon cancer. And I'm like, huh, well, that's not great.
I was just terrified. I just did not know what to say. I think I started crying actually, and
did not expect that at all. Thank God for early diagnosis. Sue pushing me to get the upper endoscopy and then end up with a colon cancer diagnosis. It was about a year later, and she called me, and I was at work, and she called me, and she said that she was very concerned, that she was scared that she had seen some a little bit of almost a mucousy bowel movement. And
I called him, and I remember telling him, I'm scared. And that is just completely out of the ordinary for me. And he said, well, we'll call and get an appointment for your primary care and have him look at you. I said, okay. I hung up, and the minute I drove out with the kids, I said, this is ridiculous. This is just crazy. There's nothing wrong with me. I have no cancer in my family. I have no anything in my family, but maybe subconsciously I'd been aware of what he had gone through the year before.
Got 2 eggs from Sadie and Butterscotch. They supply us with our eggs every day. We get 2 each day.
So I went in, I talked to my primary care doctor. I told him the same thing. I said, I told him I'd taken these fiber pills and that was the reason for it. And he agreed that could very well have caused it. But he said, just to be safe, you've detected a change, noticed a change even one time, let's send you for a colonoscopy. And again, I said, this is crazy. I didn't believe it was anything serious, and they led me down a path that saved my life.
And she's still real woozy from the colonoscopy, and so I help her get in the wheelchair, and then we go to the physician's office, and on the way there, I told her, I said, Susie Q, they found something. They found something in your colon.
It was kind of deja vu again. It was kind of, why? Why both of us? Why, how can this happen?
Wow, here we go. I would rather go through another round of this entire colon cancer stuff versus ever having her do this.
It was already encroaching on the bowel wall, so it would have gotten through it if I had waited the 4 more years to when they recommend that you get screened.
The kids actually did quite well through this. I don't know if I got them primed for this type of stuff, but they did quite well. Living in a home where mom and dad have both had colon cancer.
What does this mean for them? I want them to eat right, exercise, and enjoy life to the fullest.
I designed it when I was on chemotherapy, and I've been putting it together since, so it's taken quite a while to build it because we built it in little pieces and stuff, but we've been having a great time with it. So it's the Chick Chalet. 2 years after that, about a year, a little bit over a year ago, I was diagnosed with metastatic colon cancer, recurrence of the colon cancer. And I'm still here to talk about it. If anybody would have asked me, would you have a donkey, 5 years ago? No, of course not.
It's much, much, much better to find something, go through that and find something in the early stages, then wait till you're having symptoms, and then it's too late, because it's definitely a curable disease if it's found early enough. I mean, everybody we talk to is just amazed that the two of us under 50 have come down with it.
Suck it up, drop your pants, and go get a colonoscopy.
I've had several friends that I've recommended, please go, because it's worth your time for you, your family, and if you have children, especially for them.